Welcome to OET Answers.
Occupational English Test. OET Answers Practice Test. Listening Test. This test has 3 parts. In each part you'll hear a number of different extracts. At the start of each extract, you'll hear this sound. You'll have time to read the questions before you hear each extract, and you'll hear each extract once only. Complete your answers as you listen. At the end of the test, you'll have 2 minutes to check your answers. Part A. In this part of the test, you'll hear 2 different extracts. In each extract, a health professional is talking to a patient. For questions 1 to 24, complete the notes with information you hear. Now, look at the notes for Extract 1. Extract 1. Questions 1 to 12. You hear a pediatrician talking to a patient called Mrs. Sonia. For questions 1 to 12, complete the notes with a word or short phrase. You now have 30 seconds to look at the notes.
Dr. Clark, I'm really worried. Emmy is only 8 years old, and she's been losing quite a lot of hair in the past month. Every time I brush her hair, or even just run my fingers through it, there's more hair coming out. It's so distressing to see.
I can imagine how concerning this must be for you. Let's talk about Emmy's health overall first. Has anything else changed in the last few months? Her diet, energy levels, or any recent illnesses?
Not really. She's been her usual self. No big changes in her diet that I can think of, and she hasn't been sick. But her hair loss is really starting to affect her. She's noticed it, and now she's scared to even touch her hair because she thinks it'll all fall out.
That's understandable. Hair loss in children can be particularly stressful. There are a few common causes of hair loss in kids Emmy's age. Let's go over them. First, I'd like to ask if she's been under any particular stress lately. Sometimes emotional or physical stress can lead to a condition called telogen effluvium, where hair enters a resting phase and sheds more than usual. Have you noticed anything that might be stressful for her?
I don't think so, but now that you mention it, we did move to a new neighborhood a couple of months ago, and she's still adjusting to her new school. She seemed fine, but maybe it's affecting her more than I realized.
That's definitely something to consider. A major life change like moving or starting a new school can be a hidden source of stress for children. While telogen effluvium usually resolves on its own once the trigger is managed, we should still look into other possible causes.
What else could it be?
There's a condition called alopecia areata, which is an autoimmune disorder where the body mistakenly attacks its own hair follicles, causing patchy hair loss. It's usually painless and doesn't cause any other health issues, but it can be emotionally difficult, especially for a child. Does Emmy have any bald patches, or is her hair thinning evenly?
It's thinning mostly all over, but there are some spots where it seems worse.
That could be a sign of alopecia areata, but we'd need to confirm it with a physical exam, and possibly refer her to a dermatologist for further evaluation. Another possibility is tinea capitis, a fungal infection of the scalp that can cause patches of hair loss. This condition is more common in children than adults. Have you noticed any redness or scaling on her scalp?
No, her scalp looks pretty normal, just the hair loss.
That's helpful information. If it were tinea capitis, you might see some redness or even feel bumps. Since we don't see those signs, I'm leaning toward either telogen effluvium or alopecia areata. However, we'll need to run a few tests to check for underlying issues like nutritional deficiencies, especially iron deficiency or low levels of zinc, which can also contribute to hair loss. Is Emmy eating a varied diet with enough fruits, vegetables, and protein?
I think so, but she can be a picky eater. She loves her fruits but isn't too keen on vegetables. Could her diet really cause this much hair loss?
It's possible. Iron deficiency, in particular, is a common cause of hair loss in children. Hair follicles need a steady supply of nutrients to stay in the growth phase, and a deficiency in key nutrients can disrupt that. We'll likely do a blood test to check her iron levels and possibly other nutrients.
I didn't realize diet could play such a big role in hair loss. What if it's not related to her diet or stress?
If stress and nutrition aren't the culprits, we might look at genetic factors. There's also a condition called trichotillomania, where children, often subconsciously, pull out their own hair, usually due to anxiety or habit. Have you seen Emmy tugging at her hair or playing with it excessively?
I haven't noticed that, no.
That's good to know. It's something we can rule out for now. After we run the tests and get some more clarity, we can discuss treatment options. The good news is that most of the conditions we're talking about are treatable, and in many cases, the hair grows back once the underlying issue is addressed.
That's a relief to hear. What kind of treatments are there?
Extract 2, questions 13 to 24. You hear a doctor talking to a patient called Miss Ansi. For questions 13 to 24, complete the notes with a word or short phrase. You now have 30 seconds to look at the notes.
Good morning, Miss Ansi Karen. So, I see from your records that you're planning a trip to South America, is that correct?
Yes, I'll be traveling to Brazil in a few weeks, and I was told I might need some vaccinations.
That's correct. Brazil is one of the countries where yellow fever is endemic, so you will need to consider getting vaccinated before your trip. Have you heard about yellow fever before?
I've heard of it, but I don't know much about it. Can you tell me more?
Absolutely. Yellow fever is a viral infection spread by mosquitoes, particularly in tropical regions like parts of Africa and South America. It can range from a mild illness with fever and aches to a more severe disease that affects the liver and other organs. In rare cases, it can be life-threatening.
Oh wow, that sounds serious.
Yes, it can be, but the good news is that there's a highly effective vaccine available, which can protect you from the disease. It's a single-dose vaccine, and it provides lifelong immunity for most people.
That's a relief. So, how long before my trip do I need to get vaccinated?
Ideally, you should get vaccinated at least 10 days before you travel, as it takes that long for the immunity to develop. You'll also receive a certificate of vaccination, which may be required when you enter some countries. In fact, some areas won't allow entry without it.
I see. Are there any side effects I should be aware of with the vaccine?
Most people tolerate the vaccine very well, but like with any vaccine, there can be some mild side effects. These can include soreness at the injection site, mild fever, or muscle aches. Rarely, more serious side effects can occur, such as an allergic reaction. But these are very uncommon. I'll be going through your medical history to ensure there's no reason you shouldn't receive the vaccine.
That makes sense. And after I get the vaccine, is there anything else I should do to protect myself from yellow fever?
Yes, vaccination is an important step, but it's also essential to take measures to avoid mosquito bites while you're there. Use insect repellents, wear long-sleeved clothing, especially at dawn and dusk when mosquitoes are most active, and stay in accommodations that are well-screened or air-conditioned.
Got it. I'll make sure to bring plenty of insect repellent with me.
That's a good idea. One more thing, while yellow fever is the main concern, there are other mosquito-borne diseases like dengue and Zika, which don't have vaccines. So, the precautions you take for yellow fever will also help protect you from those diseases.
I didn't realize that. I'll definitely be more careful.
That's great to hear. I'll also provide you with some information on staying safe from mosquito bites and some general travel health tips. Now let's look over your medical history to ensure the yellow fever vaccine is safe for you. Have you had any severe allergic reactions to vaccines in the past?
No, I don't think so. I've always done fine with vaccines.
Good to hear. We also need to check for any conditions that might weaken your immune system, such as certain cancers, HIV, or if you're on immunosuppressive medications. Do any of those apply to you?
No, I'm generally healthy.
Excellent. One last thing. Are you pregnant or planning to become pregnant soon?
No, I'm not.
Perfect. In that case, you're a good candidate for the vaccine. I'll prepare the vaccination for you today, and after we administer it, I'll provide you with your international certificate of vaccination.
Great, thank you. Is there anything I need to watch out for after the vaccination?
Just keep an eye out for any side effects like fever or soreness. If anything more severe happens, such as difficulty breathing or a rash, seek medical attention immediately, but again, these reactions are rare. Otherwise, you should be good to go.
Sounds good. Thanks for all the information, Doctor.
You're very welcome. Safe travels, and I'm sure you'll have a wonderful time in Brazil. Just remember to stay protected from those mosquitoes and enjoy your trip.
I definitely will. Thanks again.
That is the end of Part A. Now look at Part B. Part B. In this part of the test, you'll hear 6 different extracts. In each extract, you'll hear people talking in a different healthcare setting. For questions 25 to 30, choose the answer A, B, or C, which fits best according to what you hear. You'll have time to read each question before you listen. Complete your answers as you listen. Now look at question 25. You hear a medical professional talking to a patient. Now read the question.
So, Mr. Thompson, I'm going to talk you through your hormone replacement therapy, HRT, treatment for menopause. HRT can be very effective in relieving symptoms such as hot flashes and night sweats. Your treatment will begin next week, and we will monitor your progress closely over the coming months. However, there are some side effects I need to make you aware of. Most importantly, HRT can increase your risk of developing blood clots, which could become serious if not addressed early. We will ask you to be mindful of any signs of swelling or pain in your legs and contact us immediately if you notice anything unusual. You may also experience bloating and breast tenderness as part of the treatment. And next.
Now, look at question 26. You hear a medical professional explaining a diagnostic procedure to a colleague. Now, read the question.
Stories she heard from a friend. I've tried to reassure her that we'll manage the symptoms, but she still seems hesitant. I explained to her that the treatment is important, but
Who knows if she actually took in what you said or if she'll even consider moving forward with it? Do you think the family member that came with her today will help convince her?
I'm not sure. Her daughter seems really concerned about her mom, but I don't think she knows enough about the treatment process either. I think we should keep trying to address Mrs. Carter's concerns directly and explain things again, maybe in simpler terms.
Now look at question 27. You hear a nurse trainee talking to a mentor. Now read the question.
Hello, Dr. Smith. I have a situation I would like to discuss with you.
Sure, go ahead. What's the case?
I have a mother who brought her 18-month-old daughter to the clinic for a checkup, but she's hesitant to continue with the scheduled vaccinations. She believes the child is too young for so many vaccines and worries about side effects. She's otherwise cooperative but clearly anxious. I know what the recommended guidelines say, but
What concerns or objections has she specifically mentioned about the vaccines?
she's concerned about the long-term effects of multiple vaccines given at such a young age. She has read a few things online that make her believe the vaccines could weaken her daughter's immune system.
It sounds like you've identified the key issues here. So, what are you thinking might be the best way to proceed in this case?
I believe I should provide her with factual information about the safety and benefits of vaccines, while also addressing her specific concerns about side effects. But I want to make sure I'm taking the right approach, given her anxieties.
Now look at question 28. You hear a nurse talking to another nurse about a patient's hydration and nutritional monitoring. Now, read the question. Hi, Sarah. I wanted to ask you something about Mr. Edwards' chart. You know, the elderly patient who was admitted with dehydration and is on a strict fluid balance chart.
Yes, I know who you're talking about.
I noticed that you didn't record his fluid intake after lunch yesterday. His intake needs to be tracked carefully, especially with his dehydration concerns.
Yes, I know, but he seemed to be drinking steadily throughout the day, and I didn't think it was necessary to write down every little bit.
Well, it's important to stick to the physician's order and record everything. Missing any details could lead to an inaccurate assessment of his hydration status. I'm worried that this might affect the monitoring on future shifts. Now look at question 29. You hear a dermatologist discussing with a patient. Now read the question.
You've done a great job using the topical treatments I recommended. However, it seems like the patches of melasma on your face have darkened. While topical treatments can help manage melasma, sun exposure remains a major trigger for its recurrence. Even brief exposure can make it worse, especially without proper sun protection. I noticed you've been spending more time outdoors recently, which could explain the worsening of the condition. The sunscreen you're using is good, but it may not offer enough protection. It's important to use broad-spectrum sunblock with a high SPF, and reapply it regularly, especially if you're outside for long periods.
I see. I didn't realize being in the sun could have such a strong effect, even though I use sunscreen.
Yes, exactly. For melasma, it's not just about wearing sunscreen, but also about avoiding direct sun exposure whenever possible. Hats, sunglasses, and seeking shade are just as important. While your topical treatments are doing their job, limiting sun exposure is critical in preventing flare-ups. It's likely that your recent sun exposure has caused the melasma to darken again.
Now look at question 30. You hear a nurse talking to a doctor about a patient. Now read the question.
Do you have a moment? I'd like to discuss a case with you.
Of course. What seems to be the issue?
We have a patient, Mr. Tom, a 52-year-old male, who came in with a rather peculiar complaint. He says his tongue looks green and furry. He describes a strange texture, and upon examination, I noticed that the papillae on his tongue are overgrown and have a greenish tint. He doesn't have any significant pain, and there are no signs of infection. However, he is understandably concerned about the appearance.
That sounds like a case of hairy tongue or lingua villosa. It's a benign condition, but it's important to address the cause. Usually, it results from poor oral hygiene, smoking, or certain medications. The discoloration likely comes from the buildup of debris and bacteria.
We'll recommend proper tongue hygiene as the first step.
How should we proceed?
The best course of action is for Mr. Tom to brush his tongue daily with a soft toothbrush and maintain good oral hygiene. He should also reduce any contributing factors, such as smoking or using mouthwashes with peroxide. If he follows these steps, the condition should resolve in a few months. No immediate medical intervention is necessary unless symptoms worsen.
That is the end of Part B. Now look at Part C. Part C. In this part of the test, you'll hear two different extracts. In each extract, you'll hear health professionals talking about aspects of their work. For question 31 to 42, choose the answer A, B, or C, which fits best according to what you hear. Complete your answers as you listen. Extract 1. Questions 31 to 36. You hear an interview with Dr. Sarah Collins about scabies. You now have 90 seconds to read questions.
Today, we're addressing a widespread, yet often misunderstood condition with dermatologist Dr. Sarah Collins, scabies. Dr. Collins, why does scabies remain a significant public health issue, and can you give us a brief history of the condition?
You're absolutely correct. Scabies is a persistent problem, particularly in crowded living conditions and areas with limited access to healthcare. Scabies is caused by a tiny mite called Sarcoptes scabiei, which burrows into the skin to lay its eggs. The condition has been known for centuries, with references going back as far as ancient Egypt. Historically, scabies was often considered a disease of the poor due to its association with overcrowded living conditions, poor hygiene, and limited access to healthcare. However, it affects people from all walks of life. During the 16th century, the identification of the mite was a major breakthrough, but even today, scabies outbreaks are common, particularly in institutions like nursing homes, schools, and prisons, where close contact facilitates rapid spread.
Can you tell us more about why scabies is so difficult to control?
One of the biggest challenges with scabies is the time it takes to diagnose and treat. The symptoms, which include intense itching and a rash, often don't appear until weeks after the mites have infested the skin. By that point, it's likely that the affected person has already spread the mites to others through close personal contact. This delay, combined with the stigma and embarrassment often associated with the condition, means that people don't always seek help immediately. Furthermore, reinfestation is common, especially when treatment isn't thorough, and all close contacts aren't simultaneously treated.
What are the typical symptoms, and how does the condition progress?
Scabies typically starts with severe itching, particularly at night, and a pimple-like rash that often appears in folds of the skin, such as between the fingers, around the waist, and on the wrists. As the mites burrow, they leave thin, wavy lines on the skin, which are often mistaken for other skin conditions like eczema or dermatitis. The itching can be extremely distressing, and excessive scratching can lead to secondary bacterial infections. In severe cases, particularly among the elderly or immunocompromised, a form known as crusted scabies can develop, where thousands of mites infest the skin, making the person extremely contagious.
How has treatment for scabies evolved over the years?
In the past, treatments were limited and often harsh, involving toxic substances like sulfur ointments or crude oil derivatives. It wasn't until the late 20th century that safer, more effective treatments became available, such as topical permethrin creams and oral ivermectin, which target the mites directly. However, these treatments must be applied thoroughly and correctly, otherwise, the mites can survive and continue to spread. Treatment also involves washing bedding, clothing and towels used by the infected person to kill any mites living outside the body. The problem is that access to these treatments is not always available, especially in low-resource settings, leading to ongoing transmission cycles.
What is the current status of scabies control, and how are we better equipped today?
We have better diagnostic tools and more effective treatments today, but scabies remains a significant problem, especially in crowded living environments. Outbreaks can still occur quickly, particularly in places where people are in close contact, like hospitals, dormitories, and refugee camps. Public health campaigns aimed at increasing awareness, improving access to treatment, and promoting good hygiene practices are helping, but there is still much work to be done. The ongoing challenge is ensuring that everyone in a community is treated simultaneously to break the cycle of reinfestation.
What are the next steps in the fight against scabies?
The key to controlling scabies lies in better prevention, early detection, and widespread treatment efforts. Education is critical. People need to understand that scabies is not a sign of poor hygiene, but a contagious skin condition that requires prompt medical attention. Researchers are also looking into developing new medications that are easier to administer and more effective in preventing reinfestation. In high-risk communities, mass drug administration, where entire communities are treated at once, is being explored as a strategy to eliminate the mites altogether. We also need more investment in healthcare infrastructure to ensure that treatments are accessible, affordable, and administered correctly.
Extract 2. Questions 37 to 42. You hear Dr. Emily Foster, an expert in medical technology, give a presentation about the impact of AI-driven clinical decision support systems. Now, read the questions. You now have 90 seconds to read questions.
Good afternoon, colleagues, and thank you for joining me today to discuss one of the most exciting developments in healthcare, AI-driven clinical decision support systems, or CDSS. The rise of these advanced systems promises to reshape how we approach diagnostics, treatment planning, and overall patient care. CDSs are intelligent tools designed to assist healthcare professionals by analyzing vast amounts of patient data and providing evidence-based recommendations for care. While traditionally, we have relied solely on human expertise, these systems now allow us to make more accurate, consistent, and informed clinical decisions. Particularly in specialties where complex data interpretation is required, such as dermatology, cardiology, and oncology. One of the most immediate benefits of CDSS is the ability to reduce diagnostic errors. Diagnostic errors are a major concern in healthcare, accounting for a significant portion of malpractice cases and patient harm. In fields like dermatology, where some skin conditions can appear similar but require vastly different treatments, an AI-driven CDSs can analyze images and patient history to help pinpoint the correct diagnosis. This improves patient outcomes and saves valuable time. For example, a study showed that dermatologists using AI-driven CDSS saw a 15% increase in diagnostic accuracy for skin cancer. Another advantage is that CDSS improves treatment consistency. When we're talking about evidence-based medicine, consistency is key. Let's take the management of chronic diseases like diabetes or hypertension as an example. By drawing on a vast pool of clinical data and research, CDSS can provide treatment options that align with best practices. These systems offer suggestions that are in line with clinical guidelines, thereby ensuring that patients across different practices receive a standard of care that is both up-to-date and reliable. Despite all these benefits, there are still significant challenges to integrating CDSs into daily practice. One key issue is the hesitation or reluctance from some healthcare professionals to adopt this technology. Many physicians feel that these systems could undermine their expertise or even replace them. However, I want to be clear, CDSS is not designed to replace physicians, but rather to enhance their decision-making. AI is a tool, a powerful one, but it requires human oversight to ensure that the decisions made align with the patient's individual needs and circumstances. Additionally, there are concerns about data privacy and security. The massive amounts of patient data being used by CDSS make cybersecurity a priority. As healthcare becomes more digitized, the potential for data breaches grows. It is essential that robust security measures are implemented to protect sensitive information and to maintain trust between patients and healthcare providers. One of the key drivers of CDSS success is the ability to update these systems with the latest medical knowledge. Medicine evolves rapidly, and treatments that were considered cutting-edge a few years ago might now be outdated. AI-driven CDSs can be programmed to regularly update their knowledge bases, ensuring that the clinical recommendations they provide are based on the most current research and clinical trials. However, we also need to address the issue of bias in AI systems. AI is only as good as the data it's trained on, and if that data contains biases, the AI will perpetuate those biases in its decision-making. This is particularly concerning in areas like dermatology, where AI systems may be less accurate for patients with darker skin, because the training datasets often include fewer examples of skin conditions in non-white patients. Efforts are currently being made to improve the diversity of training datasets, but we still have a long way to go to ensure equity in AI-driven care. Another crucial factor to consider is patient acceptance. While patients generally trust their physicians, they may be more skeptical of AI-driven recommendations. Studies show that patients are more likely to follow treatment plans recommended by a doctor than by an AI system. This highlights the importance of communication and transparency when incorporating CDSs into clinical practice. Healthcare providers need to explain to their patients how CDSS works and how it helps improve their care. In this way, AI can become a trusted ally in the clinical environment. In conclusion, AI-driven clinical decision support systems have the potential to significantly improve healthcare outcomes by reducing diagnostic errors, improving treatment consistency, and keeping up with the latest medical research. However, successful integration requires overcoming challenges such as professional hesitation, data security concerns, and ensuring that AI is used equitably across all patient populations. By addressing these issues, we can harness the full potential of AI to revolutionize patient care, while still centering human expertise at the heart of healthcare decision-making.
That is the end of part C. You now have 2 minutes to check your answers.